Okay. Good afternoon, ladies and gentlemen. Greetings from Accra, Ghana. My name is William Ampofo. I'm the Executive Director for the African Vaccine Manufacturing Initiative. We're very happy to bring you this African vaccine webinar. Our partner for the session today is IAVI. They used to work specifically on HIV/AIDS, but now they have broadened their scope to work on various vaccines, malaria, Lassa fever, etc. So now they are known as simply IAVI. So AVMI is very happy to partner with IAVI to discuss how we can better understand social and behavioral factors that can enhance vaccine acceptance and distribution across Africa. We also what happened during the COVID-19 pandemic, and therefore IAVI and AVMI are aligning our missions together to delve into the key challenges that affect vaccine uptake. Yvonne will take us through cultural beliefs, trusts, and access barriers. We hope that through discussions on case studies and comments from experts and discussants online, we will do some collaborative problem-solving exercises, and then we will all gain some practical strategies to improve vaccine acceptance and implement effective awareness campaigns. For those of us, involved in vaccine manufacturing and who are championing vaccine manufacturing R&D on the continent, we feel it's very important to start talking now about vaccines that will be made in Africa, that will be made in my country, Ghana, that will be made in Kenya, made in Rwanda, made in Senegal, made in Egypt, made in South Africa. We need to understand all the issues about vaccine uptake so that as these vaccines are being developed and rolled out, we will have the impact in terms of uptake and use to prevent diseases and present, options for our people for better health. We hope that by the end of the webinar, we will all have insights that we can, take to action to optimize vaccine strategies throughout Africa. So this is very much in line with our concept of making, Africans key players in the vaccine manufacturing landscape across the world. So it's my pleasure to introduce Yvonne to you today. Yvonne is the Director of Socio Behavioural Research at IAVI. She's based in Nairobi. I was there a couple of weeks ago, and she's held on to this role since 2020, and she leads the strategic development and guides the global execution of IAVI's social behavioral research portfolio. She has over 21 years experience in the area of social behavioral research and worked extensively throughout Africa. Excuse me. So her bio is available on the flyer, and you can see how much work she's done if you do some internet search for some of the papers and reports that have been published. So without further ado, would like to thank our participants, who've come from various places across Africa and who have various interests, specialities. And at this stage, Yvonne, I'd like to hand over to you and share your screen and go ahead and deliver this webinar. Thank you.
Thank you so much, Prof. Ampofo, and hello, everyone. So I'll just go ahead and share my screen. Melissa, please confirm my screen is visible.
It's now visible, Yvonne.
Great, thank you so much. And hello, everyone. And thank you so much for joining this AVMI Africa Vaccine Webinar Series. As you've heard, we'll be talking about how we can optimize or improve vaccine strategy by thinking about socio-behavioral insights. So I'd like to begin by thanking all the partners who make IAVI's work possible. Now I'll just start by going over our flow for today. So we'll begin with a brief introduction to IAVI, then dive into the socio-behavioral factors affecting vaccine acceptance. We'll then discuss strategies for improving vaccine acceptance, followed by a Q&A session. And then we'll have a group discussion on a case study from Nigeria, and then wrap up with some key takeaways. So starting by introducing the organization that is IAVI. So for over 25 years, IAVI has been at the forefront of vaccine research, and initially started with the intention of finding a HIV vaccine. Over time, our work has expanded to other disease areas, other global health challenges, including TB, emerging infectious diseases like Ebola Sudan, Lassa fever, as well as neglected diseases. So really our mission is to translate scientific discoveries into affordable, accessible public health solutions. So we've done, for almost 3 decades, been pioneering vaccine science in our labs, with leading global clinical research and development partners in various parts of Africa, India, Europe, and the US. So we've worked on vaccine design, neutralizing antibodies, viral vectors, as well as product development. We also work through a capacity enhancement model where through the partnerships that we've created for our research, we actually build capacity of the various research and organizations that we work with to actually execute the work that we are partnering with them on. So to support our vaccine science, we also conduct epidemiological studies. We have a robust community engagement department. We have also a robust policy and advocacy department represented here by Ethel. And then I'm under the Global Access Department, which is where we work on aspects related to access, which includes social behavioral research as well. So this map basically gives you an idea of the presence of IAVI. So what you see in green are the IAVI offices, and what you see in red are our labs. So I'm based out of the Nairobi office, and you can see where my cursor is. And you can see we have clinical research centers in various parts of West Africa, East Africa, Central Africa, and Southern Africa, India, and the US. So we have alliances with more than 150 organizations. We have a translational development center. We are also working with policymakers and communities. We have our discovery labs, and of course, we work with our partners on the clinical research front. So now I'll get into the subject of today's webinar, and I can see we already have a poll right there. So before we get into the social behavioral factors affecting vaccine acceptance, I'd like to start with a quick poll. What do you think is the biggest cause of vaccine hesitancy in Africa? So please take a moment to submit your answers in the chat. Okay, I can see the responses coming in. Misinformation, disinformation, Distrust, okay. Well, we're getting quite a number of responses coming in. Thank you, everyone. Distrust of the government, misinformation, that's coming up a lot. lack of trust in the healthcare system. Okay, I'll just give it about another minute and then we can proceed. Please feel free to put in more than one response. Access, great. Great, we're getting some really good responses coming in, lack of awareness and knowledge. And please keep them coming even as we proceed. So thank you so much for your responses. These results will actually give us an interesting perspective as we move forward with this webinar. And I can see religion has also come up from a number of responses, great. So I'd like to introduce 4 factors that, are the primary ones that actually affect vaccine acceptance. So the WHO has developed a framework which we call the Behavioral and Social Drivers of Vaccination, or BESD. So this framework identifies 4 key domains that affect vaccine acceptance or uptake. One is thinking and feeling, social processes, and motivation. So in the thinking and feeling domain, we are talking about aspects related to risk perception, whether someone is thinking that the vaccine actually works. Social processes is anything around us, that is our family, our peers, our communities. Motivation is around the intention to actually vaccinate and is tied heavily to vaccine hesitancy, as you'll see as we proceed. And then practical issues, which are primarily from the healthcare system perspective. Are the vaccine services actually accessible? Are they affordable? And aspects such as that. So as you can see here, the WHO BSD framework was first published in 2022. So that's just only 2 years ago. So it was actually the first position paper on vaccine uptake from a behavioral perspective. And this was heavily influenced by the hesitance that was faced by various healthcare systems in terms of rolling out the COVID-19 vaccines. So what this framework has actually helped to do is develop standardized tools to be able to assess behavioral and social factors across countries and also within countries. Something you'll pick up from this webinar is that context is very important. So you'll find that each country is different, but also within countries, you have differences between places. So the paper also introduced the framework with the 4 key domains that I introduced on the previous slide. I'd like to add here that this framework was heavily adapted from a 2017 paper by Brewer and colleagues that was called Increasing Vaccination, Putting Psychological Science into Action. So it basically emphasizes the importance of systematic data collection that is targeted and contextualized for specific settings, and recommends using this framework to actually guide vaccination programs. So you can see here the framework has been illustrated. So you can see we have thinking and feeling. Do I think the disease is really serious? Do I think that the disease warrants a vaccine? Do I think I'm at risk of the vaccine? Do I think the vaccine works? Do I believe the people who actually developed the vaccine? And then also social processes. What is my family saying about the vaccine? What is my religious leader saying about it? Also, has it been recommended by people whose opinion I value? And that could be a healthcare worker. And then gender equity also comes in. And the reason for this, especially for childhood vaccine, is because the primary caregiver is the one responsible for taking the child for vaccination. So that also comes into play. How does the decision-making around the healthcare of the child work for the child to actually be taken for a vaccine? And then based on the thinking and feeling and the social processes, am I actually motivated to get the recommended vaccines? So what happens is that once you have passed this stage where my cursor is, So you think the disease is severe, you think that you need to be protected, you trust the vaccine that has been offered, and your social circle is supportive of the vaccine as well. And then I say, okay, I actually intend to get the vaccination, which is the motivation rectangle you can see here. On the other side are the practical issues from the healthcare system aspect. Are the vaccines available? Are we having problems with stockouts? Are the vaccines affordable? And that ties to both, excuse me, direct and indirect costs. So indirect costs can be things like transport. Direct costs are the cost of actually receiving the service at the healthcare provider. Are health facilities easy to access? What is the quality of services at the healthcare facility as well? Will I be queuing for 4 hours? Will I receive respect from the healthcare workers attending to me? And then that is what eventually leads us to either vaccinate or not vaccinate. So as you can see, it's not a black and white decision, kind of understanding what drives vaccination. And, all these factors actually need to be taken into consideration. So I'll begin with the aspect of thinking and feeling. So this is the first of the 4 domains. So we'll remember there are 4. Remember, there's the thinking and the feeling. We'll remember that there is the social processes, there's the motivation, and then there's the practical issues. So for this particular domain, we'll look at it from 2 perspectives. One is risk perception. So beginning with perceived disease risk. How likely does the person think that they'll actually be infected with a disease that can be prevented with a vaccine? And if they actually get infected, do they think it's severe enough to, basically justify the need to get vaccinated? And also whether someone actually feels that they're vulnerable to the disease. And then there's also the emotional responses. So this can be, am I worried about getting the disease? Am I anxious about getting the disease? Fear of infection. And then just thinking about the fact that depending on my perception about the disease, the related regret about not getting vaccinated. So here really the factors that influence risk perception are primarily 4. 1, have you had a past experience with the disease? And if it was a really negative experience, then you're possibly more likely to want to get vaccinated. Also, what do you actually know about the disease and vaccines? So your knowledge about the disease and your knowledge about how vaccines work as well. Are you getting the right information around the disease? And basically general health literacy. So as you can see here, risk perception is really, really heavily influenced by what the person knows about the disease and what the person knows about the vaccines. And also, if they've had a past experience with the disease, which would actually affect their worry and anxiety around it. Still under thinking and feeling is vaccine confidence. So here, we are thinking about the product itself. So to begin with, does the person believe that vaccines prevent disease? Does the person believe that vaccines are important to maintain health? The second aspect is concerns around whether the vaccine is actually safe, whether the vaccine has been, all the safety standards that are needed were actually followed through in the development process. So you can see that also ties in with the earlier point around actually understanding how vaccines work and also how vaccines are developed. Then we come to trust. So trust here is at several levels. 1, do I trust the people who made the vaccine, the people who decided that the vaccine needs to be rolled out, so the healthcare authorities? And then do I trust the person who's actually directly offering the vaccine at the health facility? And do I really trust the vaccine development and approval process overall? And all this is influenced by the kind of information that comes through from various sources like the healthcare providers themselves and other places like the media. As we saw with COVID-19, social media was quite a powerful tool of both information and misinformation as well. So we move away from the domain of thinking and feeling, and then we go to social processes. So social processes was the second domain we looked at. It involves family, it involves peers, it involves community, it involves our religious institutions. So here, starting out family norms, what does my family think, especially the close family members, maybe the nuclear family? Have I come from a family where people get vaccinated? My parents, my grandparents, my great-grandparents, and so on. What are my friends saying? Those are the peers, the social network effects. Also, what are the community leaders or people whose opinion in the community is actually valued saying? Because their messaging actually really influences how people think. And this came up in the poll quite a bit, religious leader norms. So what are the positions of faith leaders on vaccination? And what are their teachings related to vaccination as well? Still on social processes, so we are still on the second domain. There are additional social factors that need to be considered. So studies have found that a healthcare worker recommending a vaccine can have a really positive role in encouraging vaccine uptake. And this is specifically in contexts where there's community trust of the healthcare system. Aspects related to gender equity, so the decision-making power within the household and access to health services for women. Understanding of, the need to actually, the fact that vaccination is a social responsibility in the sense that you're actually protecting the community and how herd immunity works. So folks' understanding of herd immunity actually encourages vaccination. And then the information spread through social networks. So this can be through social media discussions or even word of mouth. So we've covered two of the domains. We've covered the thinking and feeling. We've covered the social processes. I now want to jump to motivation. So motivation encompasses the intention to vaccinate and vaccine hesitancy. So it's important to note that hesitancy is not the same as outright refusal, right? But rather a state of being conflicted about vaccination. So maybe you're receiving a lot of, confusing information about the vaccine, and so you're not quite sure whether to go ahead or not. So we can divide the key concepts for motivation into three things. One, the intention to vaccinate. So am I really, really carefully thinking about getting the recommended vaccines, finding out where they're actually offered, what is the schedule of vaccination, and willingness to actually be vaccinated when the vaccine is offered. Then vaccine hesitancy is about the state of being conflicted, like I was saying. And then lastly, we need to think about the factors that actually influence whether you intend to get vaccinated and whether vaccine hesitancy comes into play. So I hope I haven't confused you there. So my intention to get vaccinated is affected by my state of understanding whether I am actually going ahead with a vaccination or not, which is the word hesitancy, which you hear, coming up a lot. And all that is affected by four things. What are my personal health beliefs? So this ties into what I was talking about earlier, understanding of the disease, understanding of vaccines and how vaccines work. How do I perceive vaccines to be important or not important? Do I actually believe that the vaccines offered are safe and that they actually work or that they're efficacious? And then the social norms and expectations. So you can see there are some aspects that are repetitive from the social processes. There are some perspectives that are repetitive from thinking and feeling. And that's because we are not, our minds don't work in, a specific, this domain, that domain, and this other domain. Like there's interaction between the various aspects. There's interaction between how I think, how I relate to my family and my community, and how all that actually motivates me to act in a certain direction. The other aspect on motivation is now to understand, okay, now that we've covered the key concepts, what would potentially stop me from being motivated to get vaccinated? Competing priorities. I'm due for a vaccine tomorrow. I have conflicting work schedules. Logistical challenges. The facility where I need to get the vaccine is 50 kilometers away and transportation there is problematic. I could also be, truly believe the vaccine works, truly believe that the vaccine is protecting me against a disease. But then there's a sort of cognitive dissonance that comes in when thinking about side effects. And especially, the fact that in a lot of media coverage, you'll find that rather than pushing the messaging around the benefits of the vaccine, you'll pick out very many headlines around the side effects. And even though the side effects might be rare, that it just flags in your mind that this can actually happen to me. So how can you enhance motivation to try and address these barriers? Clearly communicating with people on what the benefits of vaccination are, addressing specific concerns. So if I'm concerned about side effects, maybe I'll get a sore arm, actually communicating that, the sore arm will not last very long, and really communicating the overall long-term benefits compared to the sore arm for 2 days as an example. Also making it easy for people to get vaccinated. So the less the friction in terms of how do I get to a vaccination facility? Does the vaccination facility also have the vaccines? The better. So it's really important for us to understand what motivates people to get vaccinated or not. And these motivations also differ by group. They'll differ by men, they'll differ by women, younger people, older people, people in urban areas, in rural areas. So it's really, really different. And then just continuously monitoring how these motivations change over time because they are not static. So now go to the last domain, which is practical issues. So we have covered thinking and feeling, social processes, motivation, and then we come to the practical issues. So these tend to be more on the side of the healthcare system. So they include availability, affordability, ease of access, and service quality. And these factors can actually significantly impact vaccination rates, even when people are actually motivated to get vaccinated. So on the availability aspect, one thing that communities need to be aware of is where the vaccination is actually offered, and what the schedules are, and who is eligible and who is not eligible. Also, that means that there needs to be consistent stock of the required vaccines, and stockouts need to be managed effectively. On the affordability aspect, so we talk about direct cost and indirect costs. Directly, we are talking about, is there a cost to actually get the vaccine administered, or any fees that someone actually has to pay to the healthcare provider? Indirect costs are tied to actually accessing the vaccination, aspects such as transport, maybe time off work. Probably that also means loss of income. And then also financial interventions. So, does insurance cover a specific vaccine? Are there government subsidies? So all these are the aspects that actually affect affordability. So practical issues are, basically 4: availability, affordability, and you can see the 2 on this slide, And then the last two are related to access and service quality. So ease of access, we've talked about geographic proximity. Is it a headache to get to the vaccination center? And then we also have disparities in access when you compare rural areas and urban areas. Transportation, is transportation easily available? Is convenience a factor? Do people actually have appointments scheduled, or is it first come, first serve? What does that mean in terms of extended waiting times? And ease of access then ties into the quality of services. So here, it's about the relationship between the healthcare provider and the person seeking the services. So how are the staff interacting with the patients? What are the conditions in the healthcare facility? And overall, what is the kind of satisfaction the person has when they're actually received at the facility? And so that closes our section of this webinar around the 4 domains that actually influence vaccine acceptance. So now I want to go into, with the understanding of these 4 domains, what kind of strategies can we actually put in place to improve acceptance? And before I get into the actual strategies, I'd like to begin with a few examples of vaccine hesitancy and how that actually impacted manufacturers. So, for instance, you can see here, we've had challenges around vaccine hesitancy with the polio vaccine in Nigeria. One of the popular claims was that the vaccines were contaminated. So what this meant that, there was a lot of vaccine wastage and, a drop in demand. The HPV vaccine in South Africa, and also other parts of Africa. So safety concerns, cultural beliefs, religious beliefs came into play. And what this meant for manufacturers was that you had slower uptake affecting return on investment. And this really enhanced or actually made people recognize the need for tailored communication when rolling out vaccines, and with a young population target like HPV, where young girls were being targeted. In DRC, we've had challenges with the Ebola vaccine, where there's mistrust in the healthcare system. There were also challenges with the health clinical trials that were associated with that. In Ethiopia, we have measles as well, where religious beliefs and traditional medicine preference come in strongly, especially in rural parts of Ethiopia. And what this meant was that there was unpredictable demand for the vaccines. About 10 years ago in Kenya, we also had sterilization rumors around the tetanus vaccine, offered to expectant women. So the impact of this was, a huge reputational damage and a need for a lot of crisis communication as well. Overall hesitance to childhood vaccines, we've had this documented in Tanzania, and there's been a heavy need for education on scheduling. One example related to the COVID-19 vaccine from Cameroon, there was a lot of misinformation, distrust in the government who rolled out the vaccine. And basically this meant there were supply chain challenges, and it highlighted the importance of transparency. So these are just a few examples of vaccine hesitancy examples and what the impact of that has been when it comes to supply chain management, and especially from a manufacturing perspective. So the lessons here for us really are around the need to understand the market where vaccines are actually being rolled out, and the recognition that Africa is a very diverse continent, diverse in countries, diverse within countries, and you have multiple cultures and multiple contexts, whether it's from a cultural perspective, whether it's from a rural urban perspective. So that really needs to be taken into consideration. Also, the importance of engaging stakeholders and partnering with communities right from the start when developing vaccines, the need for manufacturing and distribution strategies to be agile, given how unpredictable vaccine hesitancy can be, and really, in a wholesome way, the need to actually continuously sensitize the public on the value of vaccines. So there are 4 basic strategies for improving vaccine acceptance. And I've highlighted all 4 in the case studies that I've presented. 1 is community engagement, continuously engaging communities, and also, ensuring that it's engagement from a partnership perspective and interactive information being provided, and giving platforms for communication to take place. Communication approaches also need to be tailored to specific populations. You saw on the slide on motivations, there are various aspects that would motivate an individual to either go for a vaccine or not go for it. So this needs to be tailored. So tailored to address specific concerns, but also tailored to address the interests of various population groups. Misinformation can be very powerful. And so this needs to be continuously addressed. It's a never-ending battle. So this is something that definitely needs to be considered. And then last but not least, leveraging local influencers, whether it's politically, whether it's from a religious perspective, at any level, whether it's school leadership, leveraging local influencers to actually pass on the right message. So I'd like to stop there before we get to the next section of the webinar and just check in if we have any questions so far. And you can also...
Hi, do we have any questions on the chat box? I'm trying to see.
Hi, William. We did not have direct questions, only if the presentation and recording will be made available.
Okay. All right. So we can tell participants that if they do have any burning questions, as Yvonne is sharing with us the various evidences and research and issues, they can post them on the chat, and then we can discuss them at times like this, or she can answer them, or subsequently revert by email to them. Yvonne, you want to continue? Over.
Sure, thank you. I'll proceed now. So the next part of the webinar is actually a discussion, and it's a discussion for us to consider a situation from Nigeria, and I'm just posting a relevant article in the chat. So this is related to polio vaccine hesitance in northern Nigeria, and the impact of a grassroots mobilization campaign that was being called Majiki. So this mobilization campaign has been described in a paper by Nasiru and colleagues that was published in 2012, and more recently in 2017, another paper by Taylor and colleagues about understanding vaccine hesitancy also referenced this particular intervention. So I'll describe what is actually articulated in the paper I've shared very briefly. So Nigeria, was one of the last countries with endemic polio, and this was especially a more serious issue in northern Nigeria. And some of the states in northern Nigeria actually boycotted polio vaccination because there were rumors and distrust around the vaccines, given the political situation between northern Nigeria and the rest of the country. So one of the local councils called Gezawa in Kano State had very low polio vaccination uptake. And so in 2008, this Majigi campaign was actually initiated, where they were actually using tailored messaging through videos to educate about polio, educate about the vaccine. So before the Majigi intervention or campaign was rolled out, the baseline vaccination uptake was just about 2,800 children. And after 6 months of the campaign, the uptake increased to 11,364. So that was roughly a 310% increment in vaccination uptake. So what this meant was that there was an increase in vaccination coverage, and also a reduction in children who had never been vaccinated, which hadn't been experienced in this part of Kano State before. So for the supply chain and manufacturers, it meant there was an increased demand for the vaccines in previously resistant areas, and the need to actually meet the demand in a timely fashion. So essentially what the Majigi campaign demonstrated was that when you understand a specific context, when you tailor messaging to be culturally sensitive, and when you partner with various segments of population to pass on a message, that this can be the results. And just to add that the messaging in the videos was really addressing the misconceptions. So the creators of the campaign had actually done their research around what exactly were people thinking about the vaccine, what are the misconceptions they had, and also aspects related to trust in the government and the healthcare system. So based on this brief kind of explanation around this case study from Nigeria, I'd like us to consider 2 questions, and we can start with question number 1. How did the Majigi campaign address the thinking and feeling domain that we talked about in the behavioral framework, especially when it comes to perceived disease risk and vaccine confidence? So let's start with question number 1. Feel free to post your responses in the chat. And there are no wrong answers, so anything that comes to mind. Remember, the thinking and feeling domain is where we think about risk perception, where, am I at risk of the disease, or is my child at risk of the disease? And it's also the domain where we talked about confidence in the vaccine, so the safety of the vaccine and the efficacy of the vaccine. Any thoughts?
Hi, Yvonne. I am just unmuting or allowing everybody to talk. So if they'd like to, they may unmute, raise their hand and unmute and respond to you.
Okay. Melissa, please help me also see if there are hands raised. So far, I can't see any.
Correct. There are no hands at this moment.
Okay. Would anyone like to post on the chat? Thoughts? Yes, someone has said they address grassroots members. Edmund, go ahead. Edmund? Okay. I see another response has come in. There was a clear communication about benefits. That's correct. Thank you. Okay. So as we continue to think about number 1, I'd also like to go to the second question. So From a manufacturing and supply chain perspective, based on this case study, how can vaccine producers and distributors prepare for and respond to sudden increases in demand following successful community engagement campaigns like Majigi? How can vaccine manufacturers prepare themselves for surges in demand? Okay, I see increased production is one response. Make vaccines available in all health facilities. So that's around effective supply chain management. Thank you. I see increased production and supply. Yes, there needs to be communication between the healthcare system and the other levels of the supply chain around when shortages are looming. Okay, anyone else? I see we have a response that manufacturers should conduct pre-marketing research to understand potential barriers to uptake and address them. Excellent response. Thank you so much. Yes, so really understanding the market is crucial. Before rollout of the vaccine product, understanding the healthcare system is also important. How does the supply chain work? What is the capacity of the healthcare system to deliver vaccines as needed? And I can see someone talking about buffer stocks. That's really, really good. So feel free to continue putting in your responses in the chat as we continue to the last section of the webinar. So to wind up, I'd now like to go into why there's value in social behavioral insights when it comes to vaccine manufacturers as well as supply chain managers. So understanding these factors can actually help to improve one, demand forecasting, to inform product development, to optimize supply chains, as with the example of Kano State that we have just looked at, and also enhance stakeholder engagement. So to begin with, demand forecasting. So with social behavioral insights, you can better predict vaccine uptake in different populations. So as an example, if at the time you were the vaccine manufacturer for the polio vaccines and you have different uptake in various parts of the country, you're actually able to anticipate and prepare for what the likely demand is. Also, being able to understand the context and where vaccination campaigns are actually rolled out would help vaccine manufacturers be able to anticipate sudden changes in demand and actually be caught by surprise. Social behavioral insights can help inform product development. So remember we were talking about the thinking and feeling, where we consider risk perceptions and vaccine confidence, and also motivation to get vaccinated. So, for instance, if a vaccine, actually needs to be administered in 5 doses compared to say 1 dose, generally, it has been shown that vaccines with single doses tend to be more successful, because you're going to engaging with the facility or the healthcare system less often. With multiple dose vaccines, you tend to lose participants with an increase in, it's kind of directly related to the increase in dosage. It can help to guide packaging and delivery mechanisms, and that is because you actually understand the context of where the vaccines are being rolled out. The supply chain optimization here is where we think about how exactly would the supply chain work in this context. And this can differ within country, between countries, and so on and so forth. Understanding the social behavioral insights can also really help in managing risk. So understanding where there's vaccine hesitancy, where there's no vaccine hesitancy, can help with planning for demand and actually engaging stakeholders for strategies to address the vaccine hesitancy. This is also, of course, directly tied to the resources that are invested in different markets. Stakeholder engagement would also be helpful, because once you understand the market or the person, who's actually the consumer of the vaccine, then you're able to understand the messaging for stakeholders, specifically looking at community leadership and health authorities as well. And last but not least, it also assists with the long-term planning, so aligning production with evolving vaccination policies and programs, and adapting to any changes that come up because of the social cultural landscape. So it's a give and take between continuously understanding the social behavioral context where the vaccines are being rolled out, and actually evolving the vaccine development and rollout strategies to align with that. And so now I'd like to stop there and say thank you very much for your attention. And I can see we still have 6 more minutes for any questions or comments at this point. I see more comments have come in the chat. Thank you, everyone.
So Yvonne, there's a specific question. Will IAVI consider HPV vaccines in future?
If we can have the participant expanding a little bit on the questions, because HPV vaccines are already out in the market.
So HPV vaccines are available, and could you elaborate on what is the target group for the current HPV vaccines?
In most African countries, it's adolescent or pre-adolescent girls who are just in the preteen phase. I would need to actually confirm the age. I don't want to misinform here.
Okay, so I have a special interest in HPV vaccines because we're going to introduce them, in Ghana. It's part of the new vaccines that has been approved by our National Immunization Technical Advisory group to our Ministry of Health. So, I'm looking out for any, tips on how we can help roll this out. There have been some pilot programs. The National Vaccine Institute, which I'm associated with, has helped our HPV, clinicians do some sensitization on cervical cancer in women, and we're really looking forward to getting this vaccine, out. Yes, we have a comment that in Kenya is given to girls from upwards from 10 years of age, and I even have a colleague in the Netherlands who has boys, and then he said, knowing the risk because of his clinical knowledge, got his young boys also vaccinated against HPV. So I guess as we get more information on the risks associated with this virus and what it causes to young women, and what it can also do to young men, we'll probably have this vaccine and be rolled out. Note that because this is a vaccine for adolescents, we will need a lot more social behavioral advice and awareness to get this done.
In fact,
Mr. Farhan, if you want to speak, can you please ask for permission? Is that Mr. Farhan? I recognize the voice. Do we have any hands up who want to speak?
Yeah, and just as we wait for the hands up, Prof, to answer your question around the rollout of the HPV vaccine. So the rollout for girls in most African countries is because of resource challenges. So in developed countries, it's offered to both boys and girls, since males are carriers of HPV. And in terms of the thinking, when rolling out HPV in Ghana, I think community education campaigns are important. Strongly showing the link between HPV and cervical cancer and, the vaccine's effectiveness and safety. It's also helpful when people can see data on cervical cancer and the impact it has on their communities. It also would be helpful if you engage leadership and more specifically religious figures, especially if Ghana, like the rest of Africa, is also targeting young girls. So I think there are quite a number of processes related to the domains that we were talking about that would be helpful in considering the rollout campaign. I see we have...
Unmuted. Yeah, Yvonne, I wanted to pick up on this because we are, the voice of industry. There's an advice from Moses that manufacturers should conduct pre-marketing research to understand potential barriers to uptake and address them. This seminar is exactly, in line with that. We're not doing pre-market research, but we're trying to raise more awareness on the need to actually, do specific studies with experts, so that these are based on current, perceptions and threats to uptake. So this is a really a brilliant comment from Moses. Are there any ones that we're trying to do a quick thing because we are at the end of our webinar? So I have one last question for you, Yvonne. What are some potential challenges in organizing free or subsidized health programs to vaccinate high-risk targeted populations in Africa?
So first of all, the label high risk. Communicating what high risk means without actually stigmatizing people, and for them to understand why they're a specific target is really important. So a lot of it has to do with the messaging around the disease itself and messaging around the vaccine. So around the disease, it has everything to do with how the disease is transmitted, potential risk of the disease, which is different in different risk populations. And then related to the vaccine, vaccine safety, that the vaccine works, and also helping to address concerns around side effects. Side effects can actually be a huge demotivator for someone who actually thinks vaccine works and thinks they're at risk of the disease, going for the vaccination themselves. Yeah, that's one aspect, yeah.
We've come to the end of this webinar. It was 1 hour, and time goes so fast. I think, Yvonne, we need to work with Melissa and plan a couple more. And I'm sure we will have a lot more comments and questions and brilliant suggestions from our participants across Africa. And I probably guess maybe we did have some participants from outside Africa as well. So on behalf of the African Vaccine Manufacturing Initiative, on behalf of my own group here in Ghana, the National Vaccine Institute, I would like to thank Yvonne so much and our colleagues at IAVI for this wonderful collaboration that has shared this session on the social behavioral issues around vaccine acceptance and use. Any last words from you, Yvonne?
You're welcome, and to thank everyone for sparing time to attend. Thank you so much.
Okay.
And thank you to everyone.
Thank you. All right, I'd like to thank Melissa and the Secretariat for all the for arranging this and making sure that we stayed live all throughout and there were no hitches. Thank you so much. Bye-bye from AVMI and IVI. Bye-bye.